A lot of things happen as our skin goes through time. We have changes actually in the thickness of our skin, and that's probably one of the things that people will notice right off the bat is that on the back of our hands and our forearms, our skin will get thinner. When we look underneath the microscope, you actually can see the top layer of skin, which we call our epidermis, literally shrink in size. And so sometimes we'll start off, we'll see really thick layer, and as time goes on, we'll literally see almost just one cell across there. That's all that's really kind of protecting the insides. And because of that, we start to have a lot of water loss because we just don't have as much barrier. And so it's the difference between like a piece of cardboard versus a piece of tissue paper trying to keep water inside something. And so we start to see changes again in just dryness. Because of that, our skin tends to get itchier because of that dryness. So over time, we'll see people who bruise easier, whose skin rips easier. And so again, part of that's the component of the thinness of it, but then also it becomes less flexible. Once you add sun into the equation, all of this is just kind of sped up, and it makes it even worse. And so the big thing that what the sun does is it actually causes damage to our DNA. And so our DNA is like a zipper that is supposed to unzip, make new cells as it zips back up. And it does that over and over again, millions of times a day in our lifetime. And what the sun does is it causes that DNA to not pair up like it's supposed to. So it's kind of like having a zipper that doesn't unzip right or keeps unzipping too fast. And so those cells start to grow funny. And then that can lead to additional sun damage and changes. And so again, all those things I talked about with the texture and the thickness and the color all can get worse when there's sun involved with it. I think in the future we'll start to see some improvement of just the quality of the skin just because of sun protection. We're also seeing a lot of increased information and that on things that we can do as far as vitamins, minerals, and topical proteins and things that we can put on our skin. But it's an extremely difficult task for somebody who just goes to the store and tries to pick out what do I need to use on my skin. So again, the first thing always is doing the sunscreen, and so making sure that you're doing like SPF 30 and above every day. If you're not going to do sunscreen,
and just do you have to 30 and above even like today?
Yeah, it's always a good idea just to put it on as just kind of to get into that habit.
Okay.
We get sun, even when it's fairly cloudy and we're not going to be going outside all that long. There's always that potential for some of the UV damage, and so just kind of getting in the habit, at least putting it on your face and neck every day, because you just never know. You never know when you're going to get caught talking to somebody in the parking lot at Target that you didn't think you were going to run into, and so it's always a good idea just to start with that. Then really, building on things that are helpful, and one of the things is starting with an antioxidant, which helps to repair some of the damage that is done from the UV damage and other trauma that we have to our skin. And so antioxidants go in and basically find the damaged cells and help to get rid of them and to allow the healthy cells to continue to grow. So they're kind of like the scavengers of our skin. And so there are different antioxidants. Probably vitamin C is one of the most known antioxidants, but there's a lot of things that will say having an antioxidant on the bottle. So starting with one of those is a great way to kind of start off the morning. So you wash your face, put an antioxidant on, and then cover it with sunscreen, and that's a great way to kind of start your morning. In the evening, we find doing something that has a retinol in it or a retinoid in it. Those are vitamin A derivatives, and those actually have ingredients in them that actually tell our skin to turn over faster and to sometimes repair some of that elastic tissue and collagen that has been broken. It actually has been shown that it can thicken that top layer of skin, and so it actually does do some healing to that. We find that we use this medication also to treat acne. because it shrinks the pores down. And so there are people who are on a medication called retin-A or tretinoin, and that is in this category of a vitamin A derivative. They really do take a few weeks to months to work, and so we really do say it's probably about 2 to 3 months to start to notice some changes with it. It is not something that you tend to notice something overnight, but within a couple of months you should start to notice some changes with them.